You had a 50-50 shot and you got it right. Okay. Good morning. Happy Monday. I have Neuro Coffee in hand and it is perfect. All right. Coming off a very solid weekend, digging into a new week. Today, IFAS University Q&A at 1 p.m. Eastern. If you are not signed up for ifasuniversity.com, please go there, get yourself signed up so you can join us for today's Q&A, again, 1 p.m. Eastern Standard Time. Digging into today's Q&A, this comes from Jordan, and Jordan is a physical therapy student whose question revolved around the application of manual therapy. In many cases, I don't think that people have a very good representative model as to what they are looking at, and therefore manual therapies tend to become either a random application at a location of pain, or it becomes a situation of, oh, this is my favorite manual technique, I will continue to use this, and then it becomes a situation of when all you have is a hammer, everything looks like a nail situation, rather than a well-reasoned choice as to how and when you will apply a specific manual technique. So we actually talk through when one would be a better choice than another. So I think this is going to be a very useful video for a lot of people, especially if you're a PT student. So if you know any students that are in this learning phase of building their toolbox of manual therapies and not sure when to apply them, please pass it on to them. Which reminds me, don't forget to go to the YouTube channel and subscribe so you can get all the videos whenever you would like to access those. If you would like to participate in a 15-minute consultation, please go to askbillhartman@gmail.com, askbillhartman@gmail.com, and put 15-minute consultation in the subject line so I don't delete it, and we will arrange that at our mutual convenience. Everybody have an outstanding Monday, and I will see you tomorrow.
So I've been trying to think of like scenarios where I use manual therapy more often with your model. And this kind of ties into Matt's scenario. I was thinking like I would orient or use it when muscles are like concentrically oriented. And hopefully this is a simple question. Just because something is compressed, that doesn't mean it's concentrically oriented, right? Is this like, would I need to think more like dead guy anatomy in terms of musculature being concentrically and eccentrically oriented? I think I'm just kind of getting it a little bit mixed up.
So if it's not concentrically oriented but compressed, how would you create the compression?
Push on it.
Well, I mean, that's certainly a way to do it, right? Okay. So let's talk about what manual therapy does. Okay, from a purely mechanical standpoint. So we're going to take all the neurophys and we're just going to chuck it for a second. Okay, because we're going to make life really easy for you. All right. Soft tissue mobilization. Okay, as it's termed, right? So whatever that means. And we kind of talked about this with Matt. It's like, okay, so when would you apply that? Are you there? And keep in mind, there are ways to stimulate the soft tissue, the muscle activity manually. Okay, I'm not talking about that kind of tough stuff. I'm talking about the digs and the rubs and the pushes and the florages, if you will, right? The effleurage and the petrissage and deeper stuff, and then digging stuff and the J strokes and the myofascial and all that kind of crap, right? That is specifically applied to alter a contracted area to an expanded area. We were trying to expand that space. Okay.
Mm-hmm.
Fala?
Yep.
Okay. What would a manipulation be for?
Specific to the joint?
Well, that doesn't happen. You know that. So let's throw that one out the window. You can't be specific, right? We can narrow it down to an area perhaps, but would I be trying to promote internal rotation or external rotation with the manipulation?
ER.
So okay. So here's what you're telling me. If I take my hand on someone's rib cage and I magically pull the rib cage out into my hand some way, shape, or form, that's what you're telling me that a manipulation does? Or do I have to push on them?
You have to push on them.
I have to push on them, don't I? So what does that create? ER or IR?
IR.
Okay, so that's a compressive strategy. So whenever I need a compressive strategy, I might need to use a manipulation. When I need an expansive strategy, I might need to start thinking about applying that to the muscle, the muscle stuff that creates the compression in the first place, right? Or if I'm really cool, I could go to the other side that's expanded when I need expansion on one side, and I can compress that side and maybe get it the other side to pop out, couldn't I? This is why the representation, like understanding what you're looking at first, matters, right? So the model gives you this representation. So now every tool that they've ever given you now makes a lot more sense as to when you're going to apply it. Do I need to create expansion in this area? Then I better not be manipulating this unless I'm hoping to get like a reflex opposing response. But typically what I'm going to do is I'm going to manipulate to create an IR force, right? It's a compressive force. If I'm doing the superficial stuff, the feel-goody stuff, or the rub it because it hurts so good kind of stuff, where I'm trying to get the orientation to change, I'm moving it from concentric decentric to create the expansion. Now, when you start to wiggle stuff, right? How many cycles per second for a grade 1 MOB there, student?
I just know it's the beginning of the beginning range, end range. I just know it's like the first quarter.
Okay, so is it a high rate or a low rate?
Low.
High. For grade 1? Grade 1 is 100. It's 100 cycles per minute. Okay.
Oh.
Ballpark. Who's counting? Point being, high rate, low amplitude. Get it? Okay. That will promote what? So they told you in school it's for pain, right? They say do grade 1s for pain. Are you trying to increase a compressive strategy or reduce the compressive strategy with grade 1s?
Reduce.
You had a 50-50 shot and you got it right. Okay. That was a good guess. Did you hear the question mark at the end, everybody? Okay. So when you're doing grade 1s, I'm again trying to alter the degree of compression. I'm trying to reduce the degree of compression. As I move through the grades of force that I'm applying with mobilization, I'm transitioning from an ER representation to an IR representation. That's why it's deeper. You get it?
Yeah.
So do I need ERs or IRs? That tells you what to do. All you have to do is know where you are in the starting conditions, and then that tells you what to do from a manual therapy standpoint. That's what manual therapies are for. It's the same rules. It's compression, expansion. You don't have any other options. Okay? And we can talk about all the neurophysiological stuff that's going on, which is kind of cool, but that's a byproduct of the mechanics, because I'm applying a mechanical influence to produce a physiological response, right?
Now I have to rethink manual therapy because I used to think of it just concentric.
But you don't. It's like just look at it from the mechanical standpoint. It's like, what are you doing, right? So when people say that they are releasing things, right, and you can feel the difference. You can feel where you feel firmness and tension, and then you do something and the firmness and the tension goes away and you get an expanded representation. So you altered concentric orientation towards eccentric orientation. If that's the goal, then you're successful, right?
Right.
If I need IR, I have to apply higher force, lower amplitude, high velocity. You see it? You see the differences?
Yeah. Cool.
But if you're blind to the representation, if you don't have an effective model, now you're just flying by the seat of your pants, and then you're going to manipulation. You go, it hurts right here. Okay, I'll manipulate that spot. Well, that's kind of blind, isn't it? It doesn't really give you a good level of reasoning behind your strategy. And then maybe sometimes you'll be right. You'll accidentally do the right thing, but I think we can probably be a little bit more accurate. You'll still screw up. Everybody does, right? You'll make mistakes. You'll misinterpret things, but I think you'll be a lot more accurate when you start to look at it from from the modeling representation of like, okay, is this a compressed area and expanded area? Okay. Maybe you can manipulate above the compressed area and you get expansion. Maybe you manipulate the opposing side and you get the expansion. Maybe you apply soft tissue or some sort of superficial manual technique, right, on the compressed side and you get the expansion. It's like, just understand what you're looking at and then strategize.
The specific scenario of traction on the hip, because they're supine and you're doing like your grade ones, just traction. If they're supine, where are they kind of like
is traction a compressive strategy or an expansive strategy?
Expansive.
Yeah. Where? Hang on. Let's say that you're pulling on somebody's leg with the intention of influencing the hip joint. Okay. So I pull on the leg. Am I creating expansion at the hip or compression at the hip?
Expansion.
Okay, solid. If I pull hard enough at the wrong angle, could I create a compressive strategy in the spine?
Possibly, I guess.
What if I accidentally pull you into like an anterior orientation?
So
Oops.
it depends on the specific type of.
It depends on direction, depends on force, right? If I pull too hard and they don't relax, did I create a compression or an expansion?
Compressive.
Yeah, unintentionally, didn't I? So how, where, what matters? That's when you got to get good, right? That's where you got to be reliable with your measures and you got to be reliable with your technique. So that takes practice.
Can't just lay them down and pull on their leg anymore, I guess.
Well, that's how I was taught. They go, it hurts right here. So sometimes we just pull on their arm. Okay. How do you know what's going on there? Well, we just do it and we see what happens. And that's, fairly reasonable, right? It's sciencey. It's trial and error. But I think, like I said, I think we can be a little bit more accurate with what we're doing. Okay.
For sure. That was awesome. Thank you, Bill.
You're welcome.